Hello, hello, hello. Welcome. Happy Tuesday. Happy Tuesday. Hello, and welcome to Abby Tyler's Healthy Living Tuesday show. My name is Abby Tyler. I am your host, practicing family nurse practitioner and community health volunteer. Hope you all are well today. As you can see from the title, is it seasonal allergies, flu, cold, or COVID? Thanks to those of you who will be joining me during this broadcast, and for those of you who will be joining me later, I say thank you as well. It's always my disclaimer: whatever I say here is from my practice and from different guidelines. Do not make any changes to your regimen without first consulting your own provider. So, no further delay, let me just get right into the topic here. I almost didn't come on today because, ironically, I also am suffering from seasonal allergies. So you can tell from my voice, and stuffy nose and sinus headache and all. I had that all over the weekend. Still trying to get over it. So most people are saying, well, we don't know what are you having, if you have the flu, is it COVID, is it seasonal allergies? For most people who have seasonal allergies, you get it, especially the spring seasonal allergies. I'm gonna put my glasses on. Especially if it's spring seasonal allergies, when you get it this time of the year, you start getting your runny nose, you start getting watery eyes, um, stuffy nose, nasal congestion, sinus headache, sinus pressure, and all that all comes with seasonal allergies. And there's so many things that can cause that too. And of course, we also have people coming in who are still getting tested for COVID because people are still testing positive for COVID. Everybody, I think, you send a kit to everybody's house by now, so you should have at least 3 to 4 for each family member, so you can get tested in. That's a rapid test. That's pretty much, if in case, unless if your school or employer asks for something different, you can go with that. So for allergies, let me just go through here. The symptoms of the flu. You're talking about fever, headaches, general body aches, fatigue, cough, chest pain or discomfort, and sometimes shortness of breath. As you can see, most of these symptoms are also similar to other symptoms like the flu and the cold and all that. So that's most of the reason why some of this is like can be a little hard to determine until we get the person in office, or we can do that symptomatically and go on from there. The most important thing is we can miss the flu, we can miss the cold, we can miss the allergies, but we don't want to miss COVID, especially if the COVID is going to progress to something worse than that. So part of the flu, again, the nasal congestion, like I said, a runny nose and sore throat, but you won't like dizziness and all that. Very rarely that will happen. And your allergies, there's so many things, allergy reactions. There's so many different things that are, so it's like seasonal allergic rhinitis. So stuffy nose again, runny nose, sneezing, coughing, itchy eyes, nose and mouth, watery, red or watery eyes, and swollen eyelids. Those are all symptoms of allergies. I'm not going to make this too long today, okay? In the rare cases, you have shortness of breath, very rare shortness of breath, increased heart rate, or anything that has to do with like something very severe that you have to go to the hospital for when it comes to allergies. For those of you who have asthma and other COPD and other respiratory issues and all, of course, if you also have seasonal allergies coupled with that, it can make the situation even worse. So, of course, you want to check with your doctor so they can give you additional medication to ward that off if that's the case. Okay. Alrighty. I'm gonna put this as I have a nice little compilation, a comparison, what is COVID, the common cold, the flu, allergies, and all that. I'm gonna put that in the comments section. All right. So I would go in here, and headaches for COVID. You can have headache, you can have dizziness, loss of smell, diarrhea, low pulse rate when they put the oxygen thing on your finger. Anything that's less than 89, we start getting a little concerned. If you smoke, also that can also be a concern. So common cold and most of these things, when you start getting, and you can start getting like the flu and think that it's just the flu and it could be COVID. So if you're really concerned, of course you want to make sure you will get tested. So some of the causes of allergens, there are a variety of causes, and the allergens are foreign substance that your body reacts to. So you can get it from pollens for people like us this time of the year, dust mites, pet dander, just environmental. So when you come to the office to get for your interview, for your visit, we usually ask you any food allergies, any drug allergies, or any environmental allergies, and any pet allergies. So we have that, make sure we get that listed when you do that. So for the flu, Most of the time it's like you come to the office, we'll actually all your symptoms that you're having, and then we'll listen to your lung sounds, making sure we're looking for kind of wheezing or any stridor or anything that's going to be causing difficulty breathing that may exacerbate the situation. We're checking for your temperature, we're going to be checking for your oxygen level. We'll be doing the same thing again if you come in with like a really bad cold, because when you come in, we do all of that regardless. So, but with respiratory issues, we do all that. And to diagnose the flu, we can do the rapid test. That's also what the COVID stuff. We can just go swab your nose back and forth and send it. We can get it within 15 minutes, get your results in 15 minutes. For the more definitive one, we can send it to the lab. And the flu is like A or B, the different types of strains. You know that because every year the strain changes, and they have to make a different kind of vaccination every year. And for your COVID, also the rapid test. And then, of course, if your job or anywhere requires you having a PCR test, we do that to be a little more exact. All right. The COVID test usually PCR test usually takes like 48 hours to come back. All right. So for your allergies, usually the healthcare provider will be able to do that. Usually it'll be like an allergy and asthma specialist. They can do different diagnoses. Will do your family, will send you to the, of course, we'll be doing your original stuff in the hospital, in the doctor's office, and then we send you to the specialist. So we'll check for your family history, you do physical examination. We'll get for more diagnosis, they can do some blood work, or they can do like a skin test and then send that up, and they can see all the many things that you're allergic to, and then tell you like how to prevent your triggers as well. So as of now, there most of the places are going back to indoor masks because the numbers are going back up again. There's places where you don't have to wear a mask, and there's some people I've been seeing on TV where people are like, "Oh yeah, why are you wearing a mask? Or you're sheep, you're this, you're that. You're so trained to wear it." Like I put in my previous post, if you have issues where you have pre-existing conditions, where you have like if you suffer from asthma, bronchitis, COPD, those are all lung diseases, and anything else that you have pre-existing conditions that if you get sick, you could get really really sick and then end up in the hospital. You wear your mask. Don't let anybody make you feel bad about it. That's you protecting yourself. I don't get why people will feel bad, if they have to wear a mask. I go to other places where you don't have to wear a mask and people are wearing a mask. I'm like, okay. I mean, I'm so used to wearing mine at work. I never stopped wearing it at work. So like 8 hours a day, I have it on. So usually during the weekend, I take it off because I just want to have a little break. But if I'm going somewhere where I know it's gonna be really crowded, I always have my mask in my bag and I can just take it and put it right back on. Um, it's like, yeah, so like stuffy. And also, there's some people who have family members who have cancer and other things, and also they may have those respiratory diseases that they need to protect their family members for. So if you see them wearing a mask, don't say, okay, why are you wearing a mask? You can take it off and this and that. You're not living in that person's house. You don't know what's going on in their lives. So don't talk to them about that. Excuse me for a second. So you can go to allergies and they do all the blood tests, like I said. And for treatment, the flu and COVID, flu, COVID, and all that, mainly we treat you symptomatically. It's not, one thing you go back to the Vicks, you can put the Vicks in your vapor rub and all. But if it's anything we'll treat you the supportive care, mainly what it is. We're going to be treating the symptoms with cough suppressants, can use some lozenges. We tell you to make sure you increase your fluid intake, preferably water or like juice or stuff, but not beer, not alcohol. Get plenty of rest because your body needs to rest and recover. If you have fever that is lasting much longer than 48 hours, if you have fever the first time is like over like 100 or stuff like that, you want to make sure you call your doctor's office and talk to them about it and see if they might say give it time, because most of the time when you're sick with the flu, you can feel so bad and you're like knocked out and you're like, oh my god, I don't think I'm going to live, and you're going to be concerned. We'll call you in and say, come in and get the flu, come and get the rapid test, the COVID test. You can also get tested for the flu as well. And if you have sore throat, we also can test that to make sure it's not strep, it's just allergies that you're going through. Like I said, we want to make sure that you're not having anything more serious than what it is that you may think you have. And sometimes the symptoms are so similar that we want to make sure that we don't miss the most important one. Okay. Let me go in here. And then also for the flu, usually when they're first starting, the first 24 hours or 48 hours or so, we start you on antiviral medications. Usually we start you on that because if we start later, it's not gonna do you any good. So it's always like as soon as you start feeling it coming on, and most people, unfortunately, most people don't know, what they have because it doesn't progress into something bigger until a couple of days later when it's too late to do the antiviral medication. So your treatment of your allergies, allergy management, symptomatic relief, making sure you watch for your triggers. The pollen counts in your area. Make sure you watch the news. Even if you don't want to watch the news, you can get in the weather report on your app and see what the pollen count is going to be in your neighborhood. Like I said, most important thing is knowing your triggers. If you know it's going to, if you do a lot of things outside during the time where the pollen count is going to be heavy, try to stay inside until then if it's possible, but always put your mask back on. One of the most important thing. That's why you don't hear too much about the flu and everything else. You can just wear your mask because that blocks everything out anyway. So you can wear that when you're outside, and when you go back inside to your family, you can take it off. Okay. And for the allergies, we treat you with antihistamines, the corticosteroids, decongestants, and other things. Your allergist would talk to you and tell you what it is that you really need to do. The most important thing I want to say here is antihistamine, because the histamines are the little thing, the particles that are in the air that are going into your nose. For regular people, they can, everybody has the ability to block it for it not to bother you. But if you suffer from allergies and all that, to your ability to be able to block it is not as strong as the other person. So they give you antihistamine, where like your little nasal spray, or you can take some medication for decongestant. But you always want to make sure, if you have like cough medicine and things like that, if you have diabetes, you want to make sure you check in with your doctor to make sure which kind of medication you're taking, because that can also raise your blood sugar level. And also with antihistamine, especially like the nasal spray and things like that, do not use that just willingly like that. Don't put it. I've seen some people where they're sitting down somewhere and they just have the thing in their nose and they're breathing it in and they're breathing it in. What that does is it's supposed to, because the histamines are everything, all these little particles are in the air, they go into your nose. What the antihistamine does, it closes your blood vessels, so it blocks the histamines from going into your bloodstream, okay, into your airway and everything. Well, when it does that, it also, not only does it block the blood vessels over here, it blocks blood vessels in other different parts of your body. So if you are taking blood pressure medicine, okay, which is supposed to open up your blood vessels and for the blood to flow freely. But if you're taking another medication that's keeping your blood, that's closing your blood vessels like that, that can raise your blood pressure dangerously high. So it's not something that you want to be doing. Oh, my nose is really stuffy, I'm going to use this some more. I mean, it's normal that you want to do that so you can get some kind of relief. But it's very important that you talk to your doctor about it, and also read the manufacturer's recommendations and all the different disclaimers saying do not use this, if it's that. Most important thing is speak to your doctor first before you start doing any, even though it's over the counter, but you still want to be very 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 careful, because it can cause a heart attack, it can cause a stroke if it's constricting your blood vessels like that. Okay. So, as far as prevention from the flu, practice good hand hygiene, because everything. These are all just germ factors just coming in, especially if you have younger kids at home. They're just bringing it from daycare and school. Everybody's touching their face and doing that. If they're wearing a mask and doing this and doing it, and I've seen people who wear masks like to touch the inside or put it back and then open it back up and put it in the face. You're just infecting yourself. So make sure you're not doing that. Avoid people who are sick. I mean, some people have to go to work because they don't have any more sick time off and they have to go to work. Um, Avoid people who are sick. Avoid going to work if you are sick. Again, if you don't have time off and you can't afford it like that, you have to go to work. That's just what it is. Um, Let me see here. Go in here, there. Okay. You want to get vaccinated for the flu every year. So different, if it's different strain. So when people say, well, I don't know, did I get vaccinated for the flu? Should I get vaccinated for COVID? So yeah, you want to make sure you get vaccinated for both, especially for people who have, like I said, a lot of pre-existing conditions, and all. You want to get vaccinated for flu. And if you have heart problems too, it's not just respiratory issues. If you have heart problems too, you want to make sure that you stay healthy for that. Masking, I said that again, want to make sure you're wearing your mask as much as possible. You can also, other things you can do when you're, for allergies, watch your pollen count in the area. Like I said, you can do some air filtration in your house, and people go to bed at night to avoid being stuffy. Have some humidifier. You have the humidifier on. Have some filters. Use air conditioning instead of fan, because the air conditioning going to suck the stuff out of there, out of the circulation. The fan just kind of blows it around. Keep your windows closed when pollen counts are high. So, like I said, you can grade on your phone, look at the pollen count in your area. They usually will tell you pollen counts are high for those people who are suffering from allergy issues. Make sure you stay inside and close your window during that time. Wash your hair before you go to bed or cover it up. Wear protective clothing, and when you're doing yard work or pet care, because in case if you have allergies to pet and yard work, I used to love like kind of helping my husband out with the gardening. I think my other forum I made some videos where I used to do gardening and all, but then a couple of years ago I realized I'm also allergic to the grass, which is really weird. So it's like I always have to like cover up, or I'll just not help there and I just go in there. And like I said, I never really did that much of the gardening anyway. I was the one who just did the presentation and made it look good. So he was the one who did most of the work because I would leave from there and I'd be scratching all day. So most important thing, I used to make sure I wake up in the morning and then I just get me some Claritin or Zyrtec and take it over the counter. I like again make sure you're talking to your doctor first. Change your clothes after exposure. Don't the same clothes that you did out you played outside with and all that. Even with if you're not doing gardening, where if you've been playing outside, the kids they've been playing outside all summer long or spring long when they come in, if they have allergies, making sure they take it off right away, take a shower, freshen up and all that. Even if it means to just brush off their skin, if they can't change their clothes right away, do that. And especially if they're going to school, to make sure that usually they have a card stating that what kind of illnesses they have anyway. So if they have to go to the nurse's office to get their medication, make sure to do that. But the most important thing is to get your medication and take it first thing in the morning, especially when you look at the pollen count. Okay, and if you're taking something over the counter, you want to take it before going out there. Right, and so basically, the cold, the flu, COVID, allergies, it can be kind of hard to tell apart. It can be very hard to tell apart, even for seasoned health professionals, because, like I said, there's certain diseases where they kind of mimic each other so much to where you're like, oh, this is that. But the most important thing is we don't want to miss the COVID because, like I said, that sometimes flu too, it can also progress. They're both caused by SARS virus, but the COVID is like worse. So we don't want to miss that. But if you're feeling if you have any respiratory issues that doesn't go away over like period of like 5 to 7 days, you're still coughing and all that, call your family doctor. Any problems, shortness of breath, dizziness, headaches, you want to make sure you call 911. That's not the one you want to say, well, maybe it's just allergies or maybe it's just a cold. Maybe no, you want to call 911 and go directly to the emergency. Let them take you to the emergency room so you can get checked. If your throat is always hoarse, if you notice that it's getting hoarse most of the time, and you give other symptoms are going away, you want to bring that to the attention because it could be something much more critical than just the flu or COVID. Okay, when you talk to your doctor, they're gonna go over your history, do everything, and develop a plan that is best for you individually. All right. Again, if you experience any shortness of breath, dizziness, making sure you call 911 because you want to get to the hospital as soon as possible. If you're feeling just down and just not moving around, especially somebody who's can move around, even if they're sick, if they're just laying there, that's a sign that you make sure you call your doctor and get help as quickly as possible. COVID is still around. Okay, this is a new strand. I know they're saying that it's more transmissible, but it's not as deadly or it's not as effective as the one. It's not knocking people out, but then again, if you have pre-existing conditions or if you have people in your house that have other conditions that they can't afford to get sick, you want to do as much as possible to keep yourself safe, to keep them safe. And I think the very younger kids is still, their vaccination is not approved for them yet. So make sure you take care of yourself. I understand I am COVID tired and fatigue is like I'm over COVID. I am really over COVID. But since it's part of my job, it's something that I have to do, and it's part of I have allergies. I want to make sure I'm not, and people coming into the office, and when we're gonna be checking them, and I'm listening to the lungs, and I'm telling them to breathe and all that. The breathing, they have the mask on, but so things are escaping through the mask and coming to my face. So I'm still at high risk of getting that. So I still have to watch myself, and it's still part of what I do. And all of us who in healthcare, all of us who work in jobs where you have to keep away mask, that's for your own good. So do what you have to do to keep yourself safe. Most important thing is making sure that you ask your doctor if you have if you have diabetes, if you have other issues, can I take this medication? It may seem totally unsafe. may seem totally safe, but you want to make sure, like things like Robitussin and all that too, they have sugar in it. They have to save one for diabetics. And also the medication that you put in your nose, the inhaler, the big, it's like I said, it constricts your blood vessels and can cause your blood pressure to be dangerously high. So you want to stay away from that, or you want to use that very sparingly after you speak to your doctor. Okay. So I'm not going to be long because I don't want to start sneezing here before, and then I have to do all that because I never thought I would get it out. I never thought I had allergies. I think I didn't start getting them till like maybe 15 years ago. And I'm like, why am I, how come everybody's like sick during the winter time? And then as soon as it's springtime, then I have like, it look like I have allergies. What's going on? And I was like, I don't think I have allergies. I mean, I'm from Liberia. We always had like, and I was like, and then somebody said, well, you had tropical weather over there. You didn't have the weather that changes this drastically from season to season. And I was like, oh, well, maybe, yeah. Okay. So, and that's when I noticed, I mean, it's like my nose, and I'm not, and for those of you who are like me, who are not mouth breathers, some people can talk and walk around all day with their mouth like not closed completely. I'm not a mouth breather. So whenever I get sinus headache, it's literally right here. And I'm walking around like a little sick puppy, trying to breathe because I'm not used to like just keeping my mouth open to breathe. So, but humidifier, like I said, and wash your hands and stay healthy. And I will come back on Friday, hopefully Thursday or Friday. But I'm trying to keep it kind of light a little bit in April because I did a lot of heavy duty stuff in May, in March. But so I will be back. If I come on, I'll be Thursday evening, same time. If it's Friday, I'll Friday, same time. I don't have anything planned so far. But so thank you guys for watching. Sorry if I ran through this a little fast and all because I'm like I said, I'm so clogged up, so I don't want to be on your face and sneezing like that. So let me just see here. I'm gonna close this up and just look in here and see. Oh, thank you, Jackie Jackson asking. Thank you. I hope I feel better soon too. Get some rest. Oh yeah, I wish I could go get some rest. I have to go look at patient's chart. Oh, so Thursday and Thursday is 7 o'clock on Friday. All right. So you guys all stay safe. If you sick, stay home, wash your hands, cover your mouth, sneeze into your arm, not like this, because you're not gonna be washing your hands. Keep your hand sanitizer close by and take care. And I will see you guys Tuesday or Thursday. If you guys have any topics that you want me to talk about, please feel free to just put it in the chart there and I can, in the chat room there, and I can just look and see. All right. So thank you all for watching. This is the first time I'm going to Twitter, by the way. I just joined Twitter. It's so confusing. But thank you all for watching. I hope you all stay safe. For those of you who are watching now, I say thank you. For those of you who will be watching later, I say thank you. And I'm trying my best not to make these videos long anymore because I'm trying to just get to the point and get it over with. So sometimes it'll be a little longer, but I'm trying to keep it nice and sweet. All right. If you have any questions, leave your comments and questions below. For those of you on YouTube, just so you have family members or friends on YouTube who are not on Facebook, please look for Abby Tyler's Healthy Living and join. Turn on your bell notification so when I post, you'll be able to see it. Okay. So thank you all for watching and be safe out there. COVID is still roaming around. Be safe and take care of yourself and each other. Love you. Thank you for all your support. Goodbye and God bless.